Could AI have spotted the UK Salmonella outbreak earlier? There is currently a Salmonella outbreak in the UK that has made hundreds of people sick and left one person dead. And investigators believe imported eggs may be at the center of it. But here is the interesting question. What if artificial intelligence could detect outbreaks like this before humans realize what's happening? That might sound like science fiction, but researchers are already using machine learning to predict salmonella outbreaks. And the really interesting part is that the UK already has one of the key technologies that such an AI system would need, whole genome sequencing. So could AI have spotted this outbreak earlier? Let's look at what we actually know. First, let's establish the facts. The UK Health Security Agency declared a national outbreak of Salmonella enteritis on 18 August 2026. There are 207 confirmed cases associated with the outbreak, and one person has died. More than a third of those infected have required hospital treatment. Investigators believe imported eggs used in food businesses, particularly restaurants and cafes, are a major source of the outbreak. Importantly, authorities have not linked the outbreak to UK-produced eggs. But here is where the story becomes much more interesting. The outbreak wasn't simply discovered because lots of people suddenly walked into hospitals at the same time. UKHSA says that on 26 May it identified an increase in salmonella cases caused by a single strain using whole genome sequencing. That triggers an outbreak investigation. So what exactly does that mean? Imagine 100 people become sick in different parts of the country. On the surface, these cases might look completely unrelated. One person lives in London, another lives in Yorkshire, another ate at a restaurant, another ate at home, and another became sick weeks later. Traditional epidemiology has to ask, what did these people eat? Where did they go? Who did they meet? Where do they live? That's incredibly difficult when the cases are scattered, but bacteria leave clues. Their DNA contains information about their genetic relationships. Whole genome sequencing allows scientists to compare the genomes of bacteria isolated from different patients. If several patients have extremely closely related strains, that can indicate that their infections may have a common source. UKHSA has been using whole genome sequencing for salmonella surveillance for years, and research from UK public health scientists has shown that whole genome sequencing, WGS, can identify clusters that conventional methods can miss. In fact, UKHSA says WGS was what allowed scientists to identify the increase behind the current outbreak. So we are already using something incredibly powerful, but there is a problem. We are generating enormous amounts of data, and that's where AI could enter the picture. Imagine that instead of looking at one data set, an AI system could continuously analyze several streams of information at the same time. First, human health data. Where are salmonella cases appearing? Are cases increasing? Are they appearing in unusual age groups? Are several geographically separated areas showing the same pattern? And second, genomic data. Are the bacteria genetically related? Is a particular strain appearing more frequently? Is a new cluster emerging? And third, food safety data. Where have salmonella positive food samples been found? Which suppliers are involved? Which products? Which restaurants? Which distribution centers? And fourth, environmental and contextual data. Temperature, weather, geography, food distribution, perhaps even other signals that could reveal changes in exposure. An AI system could then continuously ask, does this combination of signals look unusual? And that's not purely theoretical. Researchers have already tested machine learning approaches for salmonella early warning. One study in northwestern Italy combined human salmonella cases with food safety surveillance data. The researchers used models including random forests and gradient boosting to predict the spatial and temporal occurrence of salmonellosis. The models found that factors including salmonella prevalence in food and spatial information were important predictors. The authors concluded that machine learning could provide early warnings useful for mitigating foodborne disease. And there's even newer research. A study published in 2026 developed a machine learning framework using multiple sources of food contamination and human health surveillance data. The best performing model achieved 80% sensitivity and 75% specificity in its evaluation. In simple terms, the system was able to identify many of the high risk situations while also avoiding a large proportion of false alarms. The other researchers have combined machine learning with salmonella genomic information and meteorological variables to model the potential scale of outbreaks. So there is a real scientific basis for the idea. But now comes the most important question. Could AI have detected this specific outbreak earlier? And here is why we need to be careful. We don't know. There is currently no evidence that an AI system could have detected this particular UK outbreak earlier than UKHSA actually did, and we shouldn't pretend there is. UKHSA already detected the unusual cluster through genomic surveillance in May. That's an impressive system in its own right, but imagine taking that system one step further. Instead of genomic signal to human investigation, you could have genomic signal, patient data, food data, geographic data, supply chain data, to AI risk signal, and then to human investigation. The AI wouldn't replace epidemiologists. It would essentially act as an extremely fast pattern recognition layer. It could say, these 17 cases don't look random, or these apparently unrelated cases share a genetic signature and have exposure patterns that point toward the same type of food, or even something unusual is happening in this region, and the probability of a common foodborne source is increasing. Then human investigators could investigate that signal. And I think this is where the story gets bigger than salmonella. Today, public health systems often have to react to signals that humans discover through laboratories, hospitals, interviews, and investigations. But the amount of data being generated is exploding. Genomic sequencing, electronic health records, food inspections, environmental monitoring, supply chains, news reports, even public reports of illness. Humans are very good at understanding context, but we are not particularly good at continuously scanning millions of data points for subtle patterns. Machines are. And that doesn't mean AI will magically predict every outbreak. It won't. Bad data can produce bad predictions. Surveillance systems can miss people who never seek medical care. Models can produce false alarms. And the correlation isn't proof that a particular food caused an outbreak, but AI could potentially help public health authorities answer one of the most important questions in infectious disease. Is this just a collection of individual cases, or is something bigger happening? The UK's current salmonella outbreak gives us a fascinating glimpse of where this technology could be heading. We already have genomic surveillance capable of recognizing that bacteria from different patients are closely related. We already have machine learning models capable of finding patterns in food safety and disease data. The next step is connecting these systems. And if we can do that reliably, the future of outbreak detection may not be about waiting until thousands of people become sick. It could be about recognizing the pattern while it's still small. Because when it comes to an infectious disease outbreak, the most valuable warning may be the one that arrives before the outbreak becomes obvious. And that is where AI could become a very powerful tool in public health. If you enjoyed this video, please don't forget to hit the like button and subscribe for more videos like this. Until next time, stay healthy and stay curious. See you in the next video.